Amanda is the CEO of NHS England.
What we're trying to do is a bit more of a national campaign around awareness of sickle cell disease and use that as an opportunity, I guess, to kind of draw attention to both some of the really great stuff that's going on and how we can improve care, but also some of the things that still need to change. One of the things I'm really keen to do is just hear more about your experiences.
They see that, I'm walking, I'm talking, and I'm relatively young, so they were like, oh, there's nothing wrong with you. The worst one I feel is the calling us, drug seekers, and you don't look like you're in pain and stuff like that when you come into A&E. And I just think if it was any other illness affecting white people, I'm going to be honest, we would not be getting this treatment. I was really in so much pain, like crying for hours, and it took ages for anything to be done. And their excuse was, oh, because we're short-staffed. And obviously with like morphine and stuff, you need 2 nurses to sign it off. And you can hear me screaming in pain, and I'm sorry. It's just a constant battle. And it's traumatic.
Yeah. Well, I can see, goodness me, thank you for sharing that, because that obviously brings back a really traumatic memory for you. And that should just never happen. It'd be really good to come back to kind of, so what do we need to get right so that sort of experience doesn't happen? But thank you.
Sorry, great.
Well, we're the ones who should be saying sorry for you, actually, that you ever had to go through that.
First of all, I don't know if a lot of nurses, and regardless of whether they're agency or not, they should know the basics around sickle cell itself. Yeah. So I think the fact that there's just not care for an understanding of what sickle cell is, it then creates a furthermore of, oh well, he's just in a bit of pain right now, we'll sort him out in a bit.
It's just that feeling where they don't seem to realize that a sickle cell crisis is an emergency. The outpatient care is really great, my hematologist is great, I don't have any issues in that way, but that A&E is just really, really terrible.
I mean, it's not about one organisation, this is about the NHS and our overall response and how we deal with things.
Like everyone was saying, it's about the training, it's about the level of education and understanding and compassion.
It's making sure it happens. Yeah. Thank you. Thank you all very much indeed.
Emma and I had a conversation, we knew that we needed to make some improvements. So actually, Andy, we had a chat and we thought, we don't want to change the things that we think might need changing. Actually, we need to hear from the patients what's important to them. One of their priorities was when they first come in, they would like to improve the time for their first pain relief.
A lot of people are saying this person's difficult, this person's abusive, and then I would go in and see them and they just seemed scared. I think it came from misunderstanding and a little bit of ignorance sometimes as to what the sickle cell patients were going through. But now it's really exciting because we've got a group of emergency medicine doctors, some junior doctors who were in emergency medicine, now in haematology, and a really kind of strong push from the senior nursing team in the emergency department, as well as different strategies to try and cut down the time to analgesia, like bringing senior emergency doctors to the patient much earlier on in the journey.
A ward that is opening, it's a refurbished ward, we're sort of reconfiguring again, and it's going to be opening in hopefully this summer, and it's going to be sort of designated haematology and then the second half gastroenterology. So there will be ring-fenced number of beds for patients, which means that we'll be able to really focus on skills training for nurses, people who are interested in looking after a nursing, hematological diseases and gastroenterology as well, so it's like specialist. So the patient group, I think that's good news to them. And then in that ward area, there is an area where we're kind of thinking we could probably do like a direct access for patients.